Hi everyone, my name's Gillian and I'm the lead for Physiotherapy Services, and I'm going to be talking to you today on behalf of our AHPs. So those are our allied health professionals, which includes physiotherapists, dietitians, podiatrists and occupational therapists, to name a few. And we've got some advice for you to share to keep us all well and healthy over the winter season. In terms of physiotherapy, the big message is really to try and keep active. So it's vital for all of our health and well-being, and particularly for those of us who have mobility challenges, chronic pain, or if we're recovering from injury. We know that 1 in 3 people over the age of 65 will unfortunately fall each year, so even the smallest of activities make a difference. So this can include small movements, for example, tapping your heels to your toes 5 times or marching up and down while sitting before you get up to stand. To help improve your strength and balance, we have some simple exercises that you could complete perhaps on a daily basis. So for example, whilst you're waiting for the kettle to boil in the kitchen, or if you're brushing your teeth, something that you do regularly that will just set you up to do these regularly each day. So always make sure you're safe. If you need to, try and make sure you have something to hand that you can support yourself with. So for example, hold on to your kitchen work surface. So a few just to try. You could try moving up onto your toes, so lifting your heels 10 times and then switch the other way. So moving onto your heels by lifting your toes up. You can then also practice moving from one foot to the other, so bringing one foot in front of the other, so you're standing heel to toe, and see if you can hold your balance for 30 seconds before swapping onto the other foot. The other exercise that you can do that takes 30 seconds is just to try standing on one leg. So can you hold on one leg without losing your balance before again shifting onto the other leg? And one to do in sitting. If you can find a chair you're comfortable in, just practice sitting to stand, so getting up to stand, if possible without using the arms of the chair, so you're using your body weight and your strength to bring yourself up into standing, and see if you can repeat that 10 times. Those are simple exercises that just take a few moments of our day but will help your strength and balance. If you're out and about in icy conditions, consider your footwear. Choose insulated waterproof boots with good grip and make sure that they fit you well if possible. Walk carefully if it's icy. You can use shoe grips to aid your traction, and you can also just take a slightly wider base between your feet just to reduce your risk of falls. If it is icy and bad conditions, remember to check on any elderly people that are close by you that might need some help as well. If you have an appointment with us and are unable to keep it, if I could ask that you phone as quickly as possible so we can offer it to someone else just to help with our waiting times. Our staff across Allied Health Professionals will be focusing on supporting those within our community that are in hospital to return back home safely and as quickly as possible, and try to prevent people from coming into hospital by providing therapy out in people's homes. If you are suffering with a joint or muscle problem, you can self-refer directly into us in physiotherapy. There's a link attached on the NHS Shetland website, which we will link to below. And for those who would like to, we also have the opportunity to use our digital link Theo, which is also on the NHS Shetland website. That would allow you to start your physiotherapy journey straight away from the comfort of your own home. Similarly, there are links on the NHS Shetland website which take you into the other allied health professional services should you need us over the winter period. Specifically over the festive period, remember that you can also access health information, and there's a symptom checker on NHS Inform. If you do need further advice, you can call NHS 24 on 111.